Assalamu alaikum, respected judges and colleagues. Silent smiles. A smile is often seen as a sign of happiness, right? But sometimes smiles are silent. Silent smiles represent patients whose mental health struggles remain unspoken, unheard about, yet are clearly reflected in their oral health. So today, I want to highlight a connection between them. I want to highlight a connection that we overlook in dentistry, the link between mental health stigma and oral health neglect. In dentistry, we are trained to look for caries, infection, plaque, and bone loss. But sometimes what matters most isn't what we see in the mouth, it's what we fail to notice in the person. This image represents patients who sit in our dental chair carrying emotional weight, often unseen. So today, I invite you to notice distress, not just decay. I would also like to add that evidence shows that psychological distress often manifests as neglected oral health long before patients seek help. Why mental health matters. Mental health is not separate from oral health. They are connected. Conditions like depression and anxiety, they directly affect motivation and self-care. As dentists, it is our responsibility, and it is because we are in a unique position that we can notice the early warning signs. And stigma, it keeps patients silent. It makes it difficult for patients to approach us. The hidden connection. The hidden connection is that mental health is not separate from oral health. Like systemic diseases, they have their oral manifestations. Just like that, mental health also has its oral effects on our health. So substance abuse. It increases xerostomia, which leads to decay and periodontal destruction. Anxiety, it leads to dental avoidance. And depression, it can reduce the daily oral hygiene practices, which leads to poor oral hygiene, increased risk of caries, and more. Eating disorders, they cause the enamel erosion and dentine hypersensitivity due to frequent vomiting. These are not compliance issues, they are clinical signs of psychological distress. Let me share a case scenario. A 50-year-old patient, it presents repeatedly with new carious lesions. Appointments are often missed and oral hygiene is poor. The chart labels the patient as non-compliant. But when we approach the patient with empathy, the patient reveals a history of depression, low motivation, social withdrawal, and fear of judgment in healthcare settings. So you see, the problem was never lack of concern. The problem was untreated mental distress. This is not an isolated case, it's one we see every day in dental practice. The role of stigma. Mental health stigma plays a central role. Patients, they fear judgment, and cultural silence, it discourages the open discussion. Shame and self-blame, they also prevent help seeking. So due to this, there is a result which leads to delayed dental care. Until the dental care is delayed so much that until the pain becomes unbearable, they don't even bother reaching out. But by then, the disease has advanced too far. The gaps in dental care. Our dental system is largely procedure focused, and it is constrained due to time constraints, and it lacks formal training in mental health awareness. So this creates a visible and noticeable gap where disease is treated, but the patient's underlying struggles which have caused the actual problem, they remain invisible. So I would like to say that WHO, it also recognizes oral health as an integral part of general health. But have you ever seen mental health screenings in general dental practice? Yet mental health screening is rarely included. Dentists as early observers. Dentists can be powerful early observers. They can recognize the behavioral changes using effective communication and creating a safe environment. And we can also, we should refer patients when needed. Through this, we can change outcomes. We can even change lives. Sometimes listening is as important as restoring a tooth. So why does it matter here? In South Asia, mental health stigma remains high and there is low help-seeking behavior, and psychological illness is often minimized or ignored. Dentists are trusted professionals and trust creates opportunity. Recognizing mental health does not mean becoming psychiatrists, it means becoming more humane clinicians. Finally, I would like to say that as future dentists, our responsibility goes beyond dentine, beyond enamel, and beyond procedures. When we treat the person, not just the teeth, we create lasting impact, because behind every silent smile is a story waiting to be understood. Thank you.